So Emicizumab came as a rescue for infants less than 18 months with severe hemophilia A. It was really a big burden for patients and their parents to have a central access device in order to get factor VIII prophylaxis. And factor VIII prophylaxis in this age is really critical because the incidence of intracranial hemorrhage in infants less than 18 months is around 33 times higher than the infants without severe hemophilia A. So Emicizumab prophylaxis came as a rescue for these patients and their parents, and it really helped them to get the prophylaxis without the need for a central venous line. The approval of Emicizumab was in April 2019 in the UK for all ages with and without factor VIII inhibitors. And this approval came based on the HEAVEN 1 to 4 trials. The HEAVEN 2 trial was the trial dedicated for children, and it only included 8 patients less than 2 years, so there were no data or evidence to support the use of Emicizumab in this cohort of patients. There were emerging real-world evidence that it's safe and effective, and that's why clinicians get reassured to use it since 2020. So in Birmingham Children's Hospital, we started using it in mid-2020. The first and the youngest patient was 3.8 months old. We started Emicizumab for 17 infants. The bleeding events on Emicizumab were minimal, and all of them were traumatic. Only 3 patients from the cohort of the infants had traumatic mucous membrane bleeding, and none of them had major bleeding. In terms of adverse events, there were no adverse events reported, no thrombotic or thromboembolic events reported so far. It was very well tolerated, and there were no adverse events or injection site reactions. So in terms of inhibitors, we have 3 patients received factor VIII treatment for breakthrough events. And as I mentioned, all of them were traumatic, but none of them developed inhibitors on follow-up. So our cohort of patients, in the 17 infants we used Emicizumab, it was safe and effective.